Getting an update on the Breast Health Center at Mercy Health St. Rita's. Joining us today, Dr. Nicole Nelson, the Medical Director of Radiology at Mercy Health St. Rita's. So thanks for joining us.
Thanks for having me, Holly.
Okay, so you've got accreditation, I guess, recently for the Breast Health Center. Tell us more about that.
Yeah, we just recently renewed our accreditation for the NABPC. It's the National Accreditation for Breast Programs. It is sponsored by the American College of Breast Surgeons. And what it does is there are 47 standards that we go through, designed by experts in taking care of patients with breast cancer to be sure we meet all of our patients' needs, not just treatment needs, follow-up needs, nutrition, therapy, genetic counseling. It's a really robust program that forces us to do our best, even in some areas of patient care that we may not always be in the front of our treatment plans.
Yeah, so it sounds like this is something as a patient that we should be excited to hear about and to know that you guys have gone through this, that you're there for us the whole way.
Absolutely. And the other thing that it does, and we actually just got feedback, is they have their standards and then they apply the work that we do and the statistics that you calculate and compare it to other centers across the nation. So we just got specifically regarding imaging in terms of from when you get your first exam to when you do your diagnostic or your workup imaging to when you get your biopsy. Our timeliness is actually much better than other centers across the nation. And so you get to see that information as to how you compare to other centers. So of course we all think we do a great job, but then sometimes you might find a part where, hey, we could do this better. Other places across the nation do this better. What do we need to change? What can we do to be sure that we are doing, providing the absolute best service for our patients diagnosed with breast cancer throughout their care?
So that it must take a lot then to achieve this accreditation.
I tell you what, the credit goes to our whole team of physicians and all the people that support us. Amy Berkmeyer from Putnam County, she's our local person that actually keeps tabs of all of us and all of the information. And it really is a team of about, probably 40 people that all do our part to make sure that ourselves and our colleagues are getting all of the standards met. It's a lot, but it's really, really worth it.
Mm-hmm. And so this also just raises more awareness then that, you know, we need to get a mammogram. We need to be on it for early detection, don't we?
Absolutely. So we follow the American College of Radiology standards. So we recommend starting yearly screening mammography at age 40 and coming every year after that. Awareness is key. We see a lot of women that think, oh, I don't have a family history, or I'm too old, I'm too young. Any changes in your breast, come on in. Those need to be checked out. Most of the women that we diagnose here, if you look at the bell curve, are in their 60s and 70s. That doesn't mean we don't see it in young women. We see it in a lot of young women as well. And most of our patients do not have a family history. So whether you have a family history or not, we need to see you at the Women's Wellness Center to get your mammogram.
Yeah, it kind of sounds like, you know, you hear in the news with, you know, famous people and stars that you need to advocate for yourself. That's what we need to get in our mindset as women, right? Advocate for yourself. Get in there and get testing done like that.
Absolutely. You know, there are certain types of tumors that we don't see well on imaging. It's a small percentage, but those tumors do exist. And so there are some that we only pick up when a patient says, I feel something right here. And then we really, really, really look at that spot, or we do additional testings. So patients absolutely have to advocate for themselves. Mammography picks up 95% of tumors, but there is 5% that it doesn't, or that it'll pick up later than we intend. So it's really important to advocate for yourself if you notice changes, if you notice something different that is not normal for you.
All right. Well, Dr. Nelson, thank you very much for joining us today and telling us about the Breast Center.
Oh, you're welcome. Thank you very much for having me. Have a wonderful day, Holly.
You too. All right. Don't go away. Noon Edition continues in a moment.